Hello, it's Dr. Rhonda Johnson. Today is Saturday, December 5th, 2020, and today I'm going to be talking about the widening disparity gap in deaths from COVID-19 in Black and Hispanic populations here in the United States. Well, today's message comes from a report that was released on November 24th by the Institute for Health Metrics and Evaluation, that Seattle-based group out of the University of Washington that's provided most of the modeling and projection data for COVID-19 since this pandemic started. But basically, this report, which was published on November 24th of this year, shows how bad the racial disparity gap is in COVID-19 deaths in Blacks and Hispanic populations here in the United States. Folks, in this report, they found that the risk of dying from COVID-19 is 6.9 times higher for Hispanic populations and 5.5 times higher for Black populations. And let me say this another way. If you're Hispanic or Latino, you're 6.9 times, almost 7 times likely to die from COVID-19 if you get this infection. I'll say it for African Americans and for other Black populations. If you get this COVID-19 infection here in the United States, if you're Black, you're 5.5 times more likely to die from COVID-19. Now, in case you're wondering what age groups are this report referring to, it is not the 65 to 85 age group, folks. These are younger age people, working adults who have this excess risk of dying. So they looked at all the death data. Not all states report death data by race and ethnicity. Of the 50 states, 40 consistently report race and ethnicity data. And they looked at the age and the COVID-19 deaths and where race and ethnicity was reported. And so this study made some conclusions, and it concluded that the Black and Latino populations are more likely to, one, have increased exposure to the virus, and that working age group is probably folks who are essential workers who, for various reasons, are less likely able to work from home. Now, the report also showed some geographic variations. For Hispanic and Latinos, the disparities are highest among people who live in the Washington, D.C. metro area and who live out west, particularly in Texas. For Black populations, the disparity in death rates are highest in parts of the Midwest and in Florida. This report concluded that there was an opportunity to save lives by prioritizing life-saving interventions such as PPE, personal protective equipment, masks and gloves if needed, or other PPE at all times, and ensuring adequate PPE supplies for essential workers. You know, we tend to think of essential workers as those who are in the healthcare fields, but that's not all who essential workers are. These are the people that bring us the services that we need day in and day out to live and to survive. Now, disparities in health outcomes are generally thought to be due to these socioeconomic factors, these so-called social determinants of health, but it can also be due to access to medical care, the quality of medical care that people receive when they're in the healthcare system, and a whole lot of it has to do with preventable and modifiable risk factors, these so-called lifestyle factors, the way we live, work, and play. Now, we know that for COVID-19, our Black and brown communities have poorer access to testing. We have higher rates of infection, largely due because we live in areas where we have more people, multi-generational people living in the same household, more people living in closer spaces, more reliance on public transportation and rideshare transportation. We have higher rates of hospitalization, and we tend to present sicker when we go to the hospital. And as this report shows, there's higher rates of death. So again, if you're Black and Hispanic, you have a much higher risk of dying from COVID-19. This report showed, that was published on November 24th, that if you're Hispanic and Latino, your risk of dying from COVID-19 is 6.9 times higher than that of whites. And if you're Black, your risk of dying from COVID-19 is 5.5 times higher than whites. So I'm going to talk about the controversial COVID-19 vaccine, a vaccine that has generated so much controversy before it even becomes available to the public. But folks, if you're Black and brown, please begin thinking about whether or not you're going to take the vaccine. It's a voluntary decision, and it's one that you should make based upon what you perceive your risks to be in terms of getting infected with COVID-19, dying from COVID-19, or recovering from COVID-19, based upon your own history and risk factors, and the risk of getting the vaccine. Now, there's going to be a lot of information about these various COVID vaccines that are coming on the market. Now, of course, you know that healthcare workers and people who are in long-term care facilities are going to be the first group eligible for vaccination. So you still have time to be gathering information and making informed decisions about whether or not you're going to take the vaccine. But in the meantime, there's some other things you can be doing too, particularly if you're Black and brown. Get a flu shot, take that vitamin D, and try to lower your stress levels by sleeping and eating right and eating fruits and vegetables to try to keep your immune system healthy. Okay, this is Dr. Rhonda Johnson. My views are my own. Stay safe, stay alive, and have a blessed day.